Our next question is, and we've touched on this a little bit, but can you please explain why we're being discouraged from celebrating the holidays?
I want to go back to something we already talked about earlier, and that is uh, I hear the frustration in that question, and I hear the sadness in that question, and a feeling of loss, because we're all feeling this sense of loss that life as we have known it doesn't feel normal right now, and we want it back. However, whether it's the social distancing and my ability to go where I want, when I want, and to be with who I want to be with. And now something that feels so sacred and important, i.e. being with your family, especially around holiday times and times of celebration. This is, again, back to what we've been talking about, whether it's, the curfew at 10 o'clock or whether it's other things. It's an attempt to try to lessen the contacts and the potential spread of this virus so that our health systems are not overwhelmed. We saw a spike start to go back up when schools opened back up and when some of the restrictions were relaxed, like late summer, early fall, And about 2 weeks later, we saw, boom, we saw it starting to spike back up. And I think there's a lot of concern that if we relax standards too much, like over the holidays, like just throw caution to the wind, 2 weeks later after that, we could see a big surge of patients showing up in the hospital. So that's why I think there's an attempt. The way I think about it personally is we're not canceling Christmas, or we're not telling people to not celebrate the holidays, but we're trying to really encourage people to think about how they do it in a different way. And by limiting it to maybe 2 families with 10 or less people, you've heard some of those guidelines, or try to do it if it's warm enough. Our family's even looking at trying to, can we bundle up and do something outside where we could be, in a socially distanced sort of way, masked up, but people still be able to get around and say what they're thankful for, et cetera. Are there some creative ways that you could do it other than just throwing away all restrictions and just sitting next? And as Katie was saying before, maybe a little bit of alcohol gets involved, and the inhibitions as far as just talking right in each other's face and hearing your uncle's old stories about years gone by. I mean, we're just asking folks to think about all of those things. So yes, please do honor the holidays and whatever your traditions are, but try to figure out how to do it in a way that would keep people as safe as possible. Last thing I'll say is, remember, the people who are dying are the older, more vulnerable, medically complex. We want to really make sure that we are not doing things that we become a vector of spreading disease to those folks in particular.
Yeah, Bill really nailed it again. And, we've actually got some data on this because we've experienced holidays while in this pandemic. And every time there was a holiday, so Memorial Day, Labor Day, 4th of July, there were very predictable bumps and spikes in cases. And it's because everybody wants to be getting together over the holidays. And the holidays that I just mentioned aren't even, the holidays that are known for necessarily like big family gatherings, the way that, say, for example, Thanksgiving is. It's one of those, it's not that anybody is trying to control people and doesn't want people to just, everybody, we don't want people to suffer. That is absolutely not what we want. And this has been really, really difficult. As Bill was saying, it's really hard on everybody, especially with the kind of big holidays coming up. But because we know that like holidays equate to bumps in cases, and we're already very much going in a direction that threatens our healthcare system and our healthcare workers, and to overwhelm those things and those people. In particular, we need to be very vigilant right now, because all we would need, the spikes that we saw after, say, Labor Day or Independence Day, those, my guess, are probably smaller than what we would see after Thanksgiving. And so that's why you're hearing people discouraging from having large gatherings, because that's especially inside, because that's how the virus is transmitted. And we're already on track to be in a very, very bad place in Colorado with our healthcare system very soon. And so if we don't do something about it, who knows? Like we don't want to be in lockdown orders. Nobody wants that, obviously, but also like at some point, it's between lockdown orders or overwhelming our healthcare system. I am willing to sacrifice a little bit more for that. And everybody's already sacrificed so much, like Bill was saying, and it's been a really trying year, and this doesn't make it any easier. But where we are currently in the state of Colorado is like, we are in a very, very precarious situation right now. And so just the idea of, the holidays are coming up and everybody wants to see their entire family. And I so get that. But trying to limit it to no more than 2 households, because especially, it's the people that you don't live with that you could potentially be putting at risk. And yes, you are putting the people that you live with at risk, but it's your households. And so just trying to cut down on the number of contacts that people have, the way that, Bill was discussing earlier.